My name is Samantha Froimson, and I am a registered and licensed dietitian at Lake Health Wellness Institute. I do one-on-one medical nutrition therapy consultations with clients, as well as coordinate group programs, public speaking events, and health fairs. Following a heart-healthy diet is one of those things that we can do to help prevent heart disease or even reverse heart disease if we've already been diagnosed with something like high blood pressure, high cholesterol, high triglycerides. So to follow a heart-healthy diet, let's keep it simple. We want to focus on our whole foods. Whole foods are foods that have nothing added and nothing taken away. So think about our fruits and vegetables. We want to make sure that we're getting a moderate amount of protein in our diet. When it comes to protein, we want to go with more plant-based sources of protein. So things like nuts and seeds will give us a good amount of protein without some of the unhealthy fats associated with meats. When we do have meat for our protein source, we want to stick with lean meats like chicken and turkey and fish. Beef and pork are things that should be eaten only occasionally, like once a week or less. Whole grains are another important part of our diet. Whole grains would include things like brown rice, 100% whole wheat bread, oatmeal, and quinoa, just to name a few. Whole grains are very important in our diet because they are high in fiber. Fiber is very important in our heart health and may actually play a role in lowering our cholesterol. So we want to make sure that we're eating a diet rich in whole grains, but pay very close attention to portion size. The portion size is a lot smaller than a lot of us are used to, so we should always read the food label to determine appropriate portion size for those whole grains. So the heart-healthy foods that I mentioned earlier are all going to be high in fiber. So fiber is one of those nutrients that can actually help to naturally lower cholesterol. Fiber kind of acts like a sponge in your body. So when you have a diet high in fiber, it will actually travel through your body and pick up floating plaque to help clear your arteries. To ensure that this process is working properly, we want to have a lot of water when we have a high fiber diet. On the other hand, foods that are highly processed, that have unhealthy fats like our trans fats, high in sugar and high in sodium, can increase your risk of developing heart disease. It can cause extra plaque to build up around your heart, in your arteries. A high sodium diet can raise your blood pressure, and too much sugar in our diet can affect our blood sugars, which in turn does have an effect on our heart health. For those of you that have been diagnosed with heart disease, you'll notice that highly processed foods did not make that list of heart-healthy foods. Foods that go through a lot of processing oftentimes are very low in nutrients and very high in other additives like chemicals, sugars, salts, and fats that we should stay away from. So even though we are trying to limit highly processed foods in our diet, there is some room for a treat every once in a while. Dark chocolate is one of those treats that is actually good for you. So this Valentine's Day, you should feel good about enjoying some dark chocolate. Dark chocolates have some antioxidant properties, which is why it is good for our heart. Now, we don't want to overdo it on the amount of dark chocolate that we have. There is no real recommendation right now, but about 1 ounce of dark chocolate most days of the week is an appropriate amount. If you are interested in changing your diet or adopting a more healthy eating plan, a registered dietitian can help. As a registered dietitian, I would sit down with a client, look at what they're eating right now, look at their past in terms of their medical history, and help them to develop a diet plan or a meal guide appropriate for them.